I'll be very brief. As Dr. Gold has said, there's just innumerable people that have made this possible. But I just wanted to tip my hat in particular to our team, nurses, RTs, and techs. You were boots on the ground 24 hours a day. You acted with courage and compassion, and I'm very proud of every one of you. Thank you. But one thing, before we do that, Rick has been trying to teach me without much success the Liberian handshake. So, should we try it?
Nice shake, and then a snap on the middle finger. Now we got to work it again. Middle finger. Thumb on the middle finger. There we go.
Hey, why don't you tell them about how people in the Marine are?
It's, one of the big losses right now in Liberia is that because of the Ebola epidemic, nobody's touching each other. So, the handshake is just a hard, and some people, when they greet you, they'll shake your hand for 3 minutes or 4 minutes. They'll just go on. They'll just keep smacking and snapping, and, it's just a whole part of the deal. And it was really heart-wrenching to get off that plane on August 4th and see some of my friends who work at the airport and stuff who I know because I've been traveling in and out of there for years, and have me want to go and have them go, "Hello, Doc. Hello. This is how we're shaking hands now."
Questions?
Dr. Sacra, how are you feeling right now physically?
I feel great, except that I am extremely weak. I have a little exercise bike that the physical therapy people and others managed to bring into my room. And I can do, now I'm up to 5 minutes on that exercise bike. But I initially started out with more, and then I'd be dead the next day, and I'd have to stop. So then I had to come all the way down to about 3 minutes, 3.5 minutes, and now I'm gradually building up, and now I'm at 5 minutes. But that tires me out. So, I just have no reserve, no energy. I'm very, very weak. But, but for routine, sitting around talking, even walking around, I feel great. But anything that requires strength, whew.
Doctor, can you describe your ordeal for the past 3 weeks? What's it been like?
Well, I have to tell you, I started out with a fever. I observed myself, kind of locked myself in my little upstairs room at ELWA for about 3 days. And when I continued to have a fever on the third day, they decided to go ahead and run my Ebola test. CDC has a mobile lab right on our compound, which was very, very, very helpful and gave us quick results by the end of the day on my third day of illness. Those results were positive for Ebola, which is negative for me. I was not, other than the fever, I did not really start feeling ill until probably day 4. But the State Department and the CDC and our mission cooperated so well together. I was booked on a flight on Thursday. And the day I started feeling ill was really Tuesday. I was up in our ELWA treatment unit for 3 days. And then they had me on a plane headed here on day 6 of my illness. I would say, honestly, I never felt like I was horribly, deathly ill. Everything was handled so quickly. I was here on day 6. I was receiving medications. I was receiving plasma from my friend Dr. Brantley. And I think I really, I was quite ill for my first 3 or 4 days here. I was quite sick. And I know Dr. Sullivan could tell you more about how they wrestled with my numbers to try and get things lined up straight instead of all upside down. But I never felt like I was not going to make it. The care was so excellent, so speedy, so prompt, that I'm just thanking God for that. But I really never got to a stage where I said, oh my gosh, I'm not going to make it. So I'm very appreciative for that. It was really very timely. The evacuation was very timely. The care here was extremely timely, and so the nurses can tell you all about my first 4 or 5 days. I was pretty sick, but I think I remained optimistic through it all, didn't I?
Doctor, was it a flu-like sickness, or were you out any pain, any real suffering, or just tired and nauseous?
Fever, vomiting, diarrhea, aches. Those were the main, and very weak. Those were the main symptoms I had. I never bled. I didn't get into a hemorrhagic phase at all. But you know, I was very weak, and those were my main symptoms.
Dr. Sacra,
Your
do you
two
have...
friends have been treated in the plant. At any point, did you wonder, why am I going to Nebraska?
I did ask. I did say, "Wow, Nebraska. Who made that decision?" And I actually was told it was the State Department. I don't know if that's true but I was told it was the State Department. But you know, hey, once I heard about it, I was like, "Cool."
I've never been to Nebraska.
Nebraska. I've never been to Nebraska. I mean, you know, I was okay. I knew
I've
that.
never been to Nebraska.
I knew that. You know, I knew that there were several facilities and that they were all fully competent to do this work. So I wasn't worried. And frankly, I think the care was excellent. So.
Probably good straw.
Yeah, I think I drew a good straw.
Dr. Sacra, do you have plans to go back and continue your mission?
I have to say right now, I've got to focus on getting well. My friend Dr. Brantley communicated with me about a week ago and let me know in no uncertain terms that this was not going to be a very quick recovery. So I think I have to take things one day and 1 week at a time. If you ask Debbie, she'll probably tell you, "Oh yeah, he'll be back in Liberia." So I'm certainly not ruling it out. I lived there for 15 years, from 1995 till 2010. I really view Liberia as my second home. So I think the odds that I'll end up back there are pretty high.
The new drug you were given, did that turn the corner for you?
What's that?
The new drug that you were given.
I think nobody knows yet. The numbers are too small. I'll leave it to the scientists to comment on that one.
Yeah, I mean, he was given essentially 3 different things. One was the experimental drug, and the second was then the serum, as he mentioned from Dr. Brantley, and then lastly, just supportive care. And so we're not sure which one of those helped or if it was a combination, but obviously he's sitting here today, and we're very happy about that.
Are you headed back home from here?
Yes. They'll figure it out soon. Yeah, headed back home.
What's going to be the first thing you do when you get home?
Probably take my dog for a nice little walk.
No, I think it'll probably be sleep. He didn't sleep last night, so.
Maybe I'll sleep, and then maybe tomorrow I'll take the dog on a nice walk out in the woods.
At the kennel.
We'll get the dog tomorrow.
Maybe.
It's my only family member I haven't seen yet.
Did you get out last night? Did you get out of the biocontainment unit last night?
No, this morning.
What was that like?
2 long showers. I'm the cleanest man in Nebraska
You
at this
were
moment.
until you started.
Then I started shaking people's hands. Yeah, it was fine. I didn't sleep well last night. I was kind of pumped up. So, but just a couple of showers and met my clothes that my wife had brought for me, and then we've had some nice gatherings already this morning. Lots of pictures and hugs, and so it's been a good morning.
Have you been getting a little stir crazy in the room?
I have to say the staff, they're not only terrific medically, as the fact that I survived this tells you, but they are awesome in bedside nursing and patient care and engaging people and connecting with people. Oh my goodness. People brought me food, people brought me my Huskers t-shirt, people brought me nachos to watch the game. I ate runzas for lunch this week. My goodness. And they, just everybody pitched in with either a story or a favorite song or something to keep me entertained. I have to say, I really was not too stir crazy. Plus we had these excellent video connections so that whenever I wanted to, I could talk with my family on a video phone. I mean, of course, 3.5 weeks in the hospital, you're going to be a little stir crazy, but it really was not bad because of my blue team out there. Go team!
Doctor, do you know how you contracted the Ebola virus? I mean, you were obviously taking precautions. Do you know how you got it?
I don't. I was caring for very sick, pregnant women at the time. Mainly, I'm a family physician. I'm not an OB, but that was sort of our first priority because when I got back to Liberia in early August, women literally had nowhere to go if they couldn't deliver their babies. There were women dying at home because there was nowhere to go. So our first priority was to get maternity services going, and so we were doing a lot of C-sections. And unfortunately, what we discovered is that this epidemic is so widespread now. The numbers are so high that even people who don't, sometimes people who don't have the classic symptoms that you're looking for, and the WHO was training us on, sometimes those people had Ebola. And we've actually had we've had 2 pregnant women since I left who did not have classic signs and symptoms and yet tested positive for Ebola at our hospital. So, I know it was one of the people I did a C-section on. We had a few who didn't make it. I have not, I've obviously not had a chance to go back and look at the charts. We were wearing, standard protective gear, but obviously something didn't go right somewhere. But labor and delivery and C-sections are can be chaotic, and we didn't have adequate staffing, I'd say. So I think that's it was in that work, but I don't know the specific patient where I contracted it.
We're thankful that none of the other staff at the hospital had contracted Ebola. Whatever event it was that Rick did, there hasn't been any other staff who've gotten it. So we were really thankful for that.
Debbie, what's this been like for you? How have you coped with that?
Well, I think I said before, and as Rick said, it happened very fast, getting him here and getting him in care, and so there wasn't really too much time to to panic about it. And really, everyone here has been so supportive and catered to all of our needs and made sure that we feel confident that things were going well, but realistic, right, Dr. Smith? And that it's yes, it's a negative experience, but actually it's been a very positive experience, and we really appreciate everything that's been done for us. So. And we had a good outcome. So when you look at it in hindsight, you can maybe forget some of the tougher moments because it all worked out.
Dr. Sacra, you said, Dr. Huell and Dr. Smith said that you were helping them understand your course of disease, and you were sharing notes with them. What sorts of things were you talking about when you first started to do that?
I just shared with them my notes about my early illness and my fever and how high it went and how long it lasted and when my symptoms came on. It's just that kind of information. And I think they were also just saying that by my mere presence here with Ebola, I was a learning opportunity, as well as being obviously a patient and a burden for patient care in that sense. But I think they were just communicating that, having me here was a learning opportunity, and they've obviously been excellent. They've picked up on it very quickly. So
Rick is a very observant physician, and we were very excited to be able to have him talk about some of the healthcare system in Liberia and some of the infection control issues and some of the Ebola cases. And we learned a lot from him about the epidemic occurring at where it's actually going on right now.
Doctor, did you share change any standard operating procedures based on maybe you learned and maybe it wasn't as effective?
Yeah, we didn't make any major. We made a lot of minor changes. I think we have drilled for years to get ready for this, but when someone shows up, I think that you have to make adjustments. You might decide, and we would sit down with the staff and decide if, say, a certain type of glove was comfortable or is able to dovetail with our taping procedures. So we made lots of little changes as we went along. And as far as the care of Rick, there just isn't much experience in the developed world, so we we learned from Emory and learned from the CDC and learned from other places that had experience, and they would call us and ask us how we dealt with certain issues. So there's a lot of information sharing going on right now.
What's your hope for those who currently suffer with the disease, Doctor?
Well, I think the big change that's going on right now in West Africa, which is good, and I just hope it continues to happen, is that more and more people are realizing that if they will get into care, they probably have close to a 50-50 chance at least. Now that's not terrific, but it's way better than if people stay home and don't get any care. So we're seeing that now as unfortunately the numbers are going up as the capacity improves. So the capacity of treatment centers is going up, but the number of people coming for that treatment is also going up. So they continue to be full, but at least more and more people are getting into treatment, and more people are coming out. And people are seeing, people in West Africa are seeing that people are coming out of the treatment units well, going home, being functional, and that's giving them courage and the idea that, well, gosh, if I get sick, I ought to go and get treatment. And that's really the key, is early, intensive, supportive care. I mean, that's the main thing that we can do, in West Africa. But that can raise the survival rate from as low as 10 or 20% up to very close to 50%. So it makes a difference.
Dr. Sacra, I know that a lot of people are afraid, and especially in hearing you don't know how you got it. How would you calm the public's nerves, I guess?
Ear?
Yeah.
Well, anyway, I think the public here is not at a lot of risk. The disease is not here. And as I've said, some people are worried about me, but I came with a big label on me that said, "This guy has Ebola." That means when I was on my way over here, everybody knew exactly where I ought to go and exactly what to do with me, which is good. Anyway, the experts can comment on this more. I think it's, I know that every hospital now has procedures in place to screen for Ebola in people who present with a fever, to ask about a travel history, every hospital has those, has that information and has that in place, and I think that's the key. And people just need to be, present early to care if they have a fever, and share their travel history if they have one, and those are going to be the keys. But I think the general public in the U.S. is at pretty low risk right now, so thank God for that.
Dr. Smith, Dr. Hewitt, do you expect that you will treat more Ebola patients here at the Med Center?
We're not certain right now. We're just taking one step at a time, and Rick is our first graduating class. And, no, it's not our decision. It's the Communist State Department, and it ties into the U.S. approach to sending troops and additional aid workers to Africa, and the limited number of special biocontainment beds in this country. So it's a complicated mix, and we'll just have to see what happens.
Dr. Sacra, Debbie, what was it like that first moment where you were able to physically embrace each other? You didn't have the video conference anymore.
It was great to get a hug. So, I mean.
I think this is the longest we've been apart in 29 years of marriage, so it was very nice to.
Yeah. Because it was a whole month. I mean, he left in August, so it was a whole month before he even got sick, so, yeah.
Just a wonderful, wonderful reunion this morning, so, yeah.
When are you guys going back home? Are you flying back home?
We're not really going to share all the details of that. we are leaving soon.
Do you ever want to see a biocontainment?
Not from this side.
From that side, you mean?
Not from being the bio that's being contained. Maybe I'll come in.
I'd be happy to give him a tour. We do a lot of tours, but that way he can be on the outside and come in and see what we do.
The doctor said he's been weak in that. How soon before he can start using his blood to help other Ebola patients?
Well, it depends on a number of things, including the measurement how strong a level of antibodies he has in his blood. It'll be done by the CDC. So his weakness is one issue, and the other issue is when his blood is going to be maximally effective. So usually you don't start thinking about that until at least a month after the virus is cleared from your system.
Reports today from memory that bio-waste, some of the sheets and things like that, there was having some issues in disposal. Are you prepared for that if we get more patients? Is that an issue here? Is that something that went smoothly here?
Yeah, we have went very smoothly, and we have a team of Sean Gibbs here and John Lowe. Our environmental experts from the College of Public Health have been outstanding, and so we have right now pass-through autoclaves so that everything in the unit goes into an autoclave, is sterilized, tested multiple times to make sure it's an effective sterilization load, comes out the other side and is handled as biohazard by the hospital waste system. So we're comfortable with our system, and we have backups in case something happens to the autoclave. But that may be one of the things, the lessons learned that's near the top of the list for us, is just the amount of bio waste from having a patient, from having all the gowning and ungowning as part of the infection control procedures. A lot of waste, and it's something that every unit is going to have to plan for.
Let's take a quick pause and connect with the folks on the phone. Anyone on the phone who are listening in, if you have any questions, feel free to ask them right now. And I also ask you to mute your phone when you are not speaking. Thank you. Any questions?
Silence.
Silence.
Doctors, can you talk a little bit about whether there's any lessons from Dr. Sacra's case that might be applied in West Africa that might make sense to use there? I know you've been saying there's a lot of conversations going on, and is there anything that you've been through here and that you all have seen in treating Dr. Sacra that might be useful in the outbreak?
Yeah, in fact, we've contacted Dr. Hewlett, talked to one of the physicians that cared for Rick in Africa, and we've gotten calls from federal agencies that are trying to ramp up the African effort. And I think one of the lessons learned is that it's not necessarily something high tech. As Rick mentioned, it might be getting a really good IV placed and giving the patient lots of fluids in the first couple of days, for instance, might make a significant difference in mortality. And we have some fancy machines, but that's not necessary. And I think you can do a lot in the field if you set up the appropriate facilities. Anything to add, Angela?
No, I mean, as Dr. Smith mentioned, we've been communicating back and forth with all sorts of different agencies, including the World Health Organization, CDC, and a lot of their questions have dealt with the logistics of taking care of Ebola patients in Africa. And when they're setting up these field hospitals, what type of equipment do they need, what type of staffing, and laboratory capabilities and that sort of thing. And so that's actually been some of our lessons learned. We've been able to communicate very well, and hopefully we'll have some impact on what's going on in Africa right now.
Take that?
Yes, I would say the shortage of healthcare workers at all levels is a huge problem, and obviously the fact that multiple agencies have now had staff members like me get sick on the job means that people who want to go and help really do have to sort of stare this thing in the face and say, it could happen to me, and that's obviously that makes it hard to recruit volunteers to come and work. But I think it's the reality of it. It's a huge. Every health facility in Liberia, for instance, lost multiple healthcare workers during July when the crisis really ramped up. And obviously, when you have seen your colleagues get ill and some of them die from Ebola, it makes it hard for you to want to go back to work and put yourself at risk. So these are huge issues. I think what it points out is actually the urgency of a vaccine. I think if we could get if we can get a vaccine going, especially to target healthcare workers, that would be huge in terms of its impact. I know it's a few months off in terms of actually getting it going. But I think when that comes around, that's going to have a huge impact on the manpower issues.
Dr. Smith, Dr. Hewitt, when were those two blood samples taken that came
comfortable with us sharing that?
Sure.
Okay, yeah. Well, we have, the CDC requires 2 consecutive blood samples 24 hours apart, which we got on Sunday and Monday. We also had, as a bonus, we had a third one from Friday that we sent that was negative. So you get an extra credit on the test, Rick. Yes. They were mailed to the CDC, and the CDC, we have a very good lab here. Pete and Tony are in the back. I see that they have the capability of testing, but the CDC, for obvious reasons, wants to just make sure that it's their test that's negative, and so that's what we were waiting for last night, the confirmatory word. Yes.
Basically.
2 more questions, please.
Or any problems or issues that for next time, I guess, you'll address or change in terms of treatment?
As far as treatment, I think the problem with treatment is a lot of institutions have 1 or 2 patients, and they try different drugs, and all this information has to be centralized at the CDC and WHO and analyzed and compared to viral levels in the blood, and hopefully that'll give some information. So procedurally, I talked about the handling of infectious waste, and there's a number of other issues. We learned a lot about, for instance, how long one of our staff members can stay gowned up without getting too hot or too tired, and we did things we sort of worked out on the run and let our staff work out. So there are many lessons learned that we've modified our procedures on.
Dr. Sacra, you mentioned when talking to Dr. Brantley, he said, heads up, this might not be the quickest recovery. What do you expect moving on from here with that recovery?
Well, of course, I don't know the pace of it, how fast it's going to go. I'm seeing my primary care doc next week. I'm probably going to see a physical therapist, and I just know I'm going to have to figure out kind of a go slow, progress it over a period of weeks kind of schedule, and we'll just have to see how it goes. I mean, I have no idea if it'll take me 1 month or 3 months to feel like I'm back to myself. But I just know, I mean, from what Ken sent, I think the key message was be patient with this process, Rick. It's going to take a while.
Rick and Debbie, thank you so very, very much for giving us your time and your confidence. Please, everybody, let's join us one more time in wishing them Godspeed in their travels, and thank you for